something, anomalies they're at risk for hypoglycemia, all right? Signs, we went over it, you know what's abnormal. You feed them, if it's below 45, they're getting IV glucose. Bilirubin, what time I got? 45, 4 minutes. Y'all know what bilirubin is? Byproduct of that. Okay, bilirubin, what is it normal to have bilirubin levels within the first 24 hours?
Yeah. Yes.
No.
It's like 3 days after.
Yeah. If you have jaundice in the first, no peeking for you. If you have jaundice in the first 24 hours, it's abnormal, okay? And some things that can contribute to that. Bruising, septic hematoma, things like that. But also poor PO intake. If you're not taking enough in from breast or bottle, and you're not peeing and pooping out that bilirubin, is how you get rid of it, you're at risk for jaundice, okay? Physiologic jaundice can start, after 24 hours or 48 and go for 7 or so days. Pathologic jaundice, I think you went over, is ABO incompatibility, and something causes it. Something is going on. It's just not a normal process that babies experience. Meconium aspiration, baby breathes it in. You can put two and two together. We've looked at alveoli enough. They get plugged up, you have a big problem. Neurologic problems, we went over IVH. Babies that have neurologic problems or neonatal seizures, you need to find out why. Is there a fractured skull? Is there bleeding in the brain? Is there a sepsis? Something is going on. Seizures are never normal. So, assessment is vital. You have to know a normal newborn to understand what an abnormal newborn looks like. APGAR scoring, you should understand, it's a numerical value. Gestational assessment, you use the Ballard score, and then systematic assessments. In the normal newborn, it's once every shift. In the neonatal situation, it's either hourly or every 3 hours. Vital signs, temp, heart rate, respiratory rate.
Every 1 to 3 hours?
A critical baby will be every hour. A normal feeder grower will be every 3 hours.
Okay.
That's in the NICU environment. In the newborn nursery, they get an assessment and vitals Q shift. Temperatures, everybody I know, you tested out in newborn nursery, you know the values there. Analgesic, Vicky covered. Behavioral states, distress signs, quiet asleep, quiet alert, signs of distress. And then the last priority that a newborn needs to transition out of normally is developmental care that balances with the physiologic needs and stimulates best development. There's a couple real quick things. Neonatal abstinence syndrome. Mom is on a prescribed drug or a legal drug. Those babies are hyper irritable. You know the various drugs that are out there. Symptoms usually occur in 12 to 24 hours after birth, especially for heroin exposure. Babies need quiet, darkened environments. They're often poor feeders and have to be gavage fed. There's a scoring system where we assess a numerical value for their symptoms and come up with a number. If the number is higher than 12, they start morphine therapy. Morphine every 3 hours by mouth around the clock to get them through those symptoms of drug withdrawal. Often can be in the NICU for 2 months.
There was a baby they thought might have this the day that we were in the nursery, and they had it. There was a blanket over it, and it was like kind of over in the corner, so it was quiet. Because I was wondering, like, why is there a blanket over that baby? What's wrong with it?
They can be 1-to-1s. Where the 24-5-weeker was a 2-to-1, withdrawing babies often are 1-to-1 nursing care. They cry nonstop, chronic diarrhea, throwing up, and that can be for weeks. If the baby gets to day 5 without a score of 12, they sometimes can make it through and go home with mom, if she can handle it. So they can stay in the newborn nursery up to day 5. After day 5, they're coming to NICU. And they go into the isolation room, except the baby's in there right now, but they go into a dark, quiet room that they can close the doors. Cocaine doesn't show NAS. It's the opiates that usually do. We don't have a meth problem here. Fetal alcohol syndrome, we saw, here's a fetal alcohol face. It's distinct, flattened area here, exceedingly spaced eyes rather than just the normal newborn with a little bit of wide. But their eyes are spaced, they're flat here, they have a thin upper lip, and it's classic. Smoking, bad news when you're pregnant, decreased birth weight, lower APGAR scores, and it's awkward when the mother says, why does my baby weigh 5 pounds? But, you know, the whole family smells like smoke. She admits to smoking 1 pack a day or 2 pack a day. Decreased birth weight and lower APGARs is related to maternal smoking. Pregnant breastfeeding, you could harm your baby. That is right on all packs. There's a mom bonding well with her infant in the NICU.
Now, when you're breastfeeding, I'm sorry,
Yeah,
when you're
go ahead.
breastfeeding and you're a smoker, the smoke obviously is bad for the baby. But does that nicotine pass to the breast milk?
Yes.
Oh,
Yep. I strongly advise, and they leave the hospital with smoking cessation pamphlets, and
Yeah.
we strongly encourage to not smoke. Even kangaroo care, we ask that they shower and come in not smelling of smoke. And they're almost always very compliant. They're, you know, they really don't want to hurt a baby. It's a prone baby. That's the best developmental position for a premature baby. Try to control auditory noise in any of the high-risk infants. And then obviously the parent-infant relationship. You know, you have to have a parent. I know somebody in here had a mother who was like, keep the baby in the nursery. You know, that's a baby that you'd start checking out, you know, you'd want to see a bonding
Yeah.
demonstration before you would, you know, feel comfortable leaving that baby with the mother.
She had 6 kids. She's like, take that thing back.
You all saw more loss than you could handle probably the first week. That first week of clinical, there was at least 4 losses in the
Yeah, it was
L&D,
brutal.
in the L&D setting.
That's a lot then in that short little bit of time.
We
that you
did
guys
see
had.
that.
They really did. They saw.
We had a good 2 weeks there.
Pass the hat, take whatever you want.